Good afternoon. I'd like to call to order this meeting, October the 13th, 2020, of the Pitt County Department of Social Services Board. I'd like to welcome you to this. And we're going to open up our meeting by observing a moment of silent prayer or silent meditation. So. Okay, thank you. We're going to begin our meeting today by having a roll call since our board members are virtual today. And so, Susan, I'm going to ask you to call the roll.
Chair Cox,
Here.
Vice Chair Bunch,
Here.
Mr. Dancy,
Saw him raise his hand.
Catherine Nelson,
Here.
Yep.
and Ms. Perkins Williams.
Here.
Okay, thank you, Susan. Okay, public comment. We have anybody for public comment?
No, sir.
Okay, thank you. So moving on. You should have gotten, or you have gotten, a copy of our today's agenda. And so if there's no need to revise, could I have a motion to adopt today's agenda?
So moved.
And a second?
Second.
Okay, Susan, do we need to take a vote on that, or are we good?
We take a vote.
Okay,
Okay. Chair Cox,
yes.
Vice Chair Bunch,
Yes.
Mr. Dancy,
He raised his
Okay.
hand.
Ms. Nelson,
Yes.
Ms. Perkins Williams.
Yes.
Okay, thank you, Susan. And we're gonna do the same with our minutes. You should have received a copy of your minutes and hopefully have had an opportunity to review. And if I could have a motion to approve, please.
Mr. Chairman, I make the motion that we approve the minutes as received.
Thank you. Could I have a second, please? Yes, thank you, Dr. Bunch. Okay, Susan, you want to call the roll again, please?
Okay. Chair Cox,
Yes, approved.
Chairman Bunch,
Yes.
Mr. Dancy. Okay, I see a hand
Yeah,
up.
you got a thumbs up.
Ms. Nelson,
Yes.
Ms. Perkins Williams.
Yes.
Okay, thank you. Okay, moving on our agenda. First thing today is we have some introduction of some new employees, and I'm going to turn it over to Ms. Jan.
Okay, I want to introduce Lynn Hollis. Lynn, if you come forward and go to the podium and introduce yourself to the board. Lynn has just joined us and she is in our Medicaid division. And so we're excited to have her. Tell them a little bit about yourself.
Well, I'm from North County originally, and but I've lived in Pitt County for probably 15 years and recently moved to Vanceboro, so now I'm Craven County. But I chose Pitt County Social Services because of the excellent training program, as I only have 3 months experience. I do have a degree from ECU in nutrition, so at some point I might consider going back for a master's in public health and hopefully move over to the ag department or the health department.
Well, thank you very much. Very nice.
Thank you.
You're welcome.
And you can stay or leave, your choice.
So we just had the one new hire.
We have the one new hire this time.
Okay. And now we're going to move on to employee service recognition. And again, I'm going to turn it over to Ms. Jan here for that.
And I believe we have 2 folks, and Mr. Elliott and Florida Hardy are both going to do those presentations, I believe. And then I will read the list of other folks who have received service awards this quarter.
Good afternoon, good evening. This is the presentation that normally occurs at the Board of County Commissioners meeting. We do a quarterly service award to the entire workforce. Okay. Good afternoon, good evening. So like I was just saying a moment ago, this is a presentation that normally occurs quarterly before the Pitt County Board of Commissioners. The employees come forward and are recognized with their certificates and anything else that their service awards they receive from the Board of Commissioners. Today, we have two DSS employees that have received or are going to receive their 20-year service recognition. I think Ms. Elliott is going to probably announce the other service
I
recognitions. We're doing 5-year increments, 5 on up to 30 and 30 years plus. One thing I want to note special about the 20-year watch is, if Florida can come here just for a second, put your hand out. So Florida has her 20-year watch.
Very nice, Florida.
And all I'm going to say is that Florida earned this 20-year watch in the year 2000. So you can guess how many years of total service she has. So we're only going to present these two watches today if you promise to have as many years of service that Florida has today. No, just kidding, just kidding.
Oh, that's good.
But we do joke and kid and say that with the 20-year watch, you get to kind of watch time tick the next 10 years until you get 30 years in the system to be eligible to retire. So we'd first like to recognize Angela May, if she'll come forward. Jan, did you want to come down? Get Jan to come down too and be part of this. I'll pass the watch to Jan, and Jan can pass the watch to Angela.
And congratulations.
Thank you.
And Angie's a part of our child care unit.
Okay,
And so
good.
we're excited to have you for 20 years.
And the second watch to Deborah Owen. She'll come forward. Again, we'll pass the watch to our director. And
Very good. And Debbie, congratulations. Debbie's part of our foster care adoption unit. So we are excited to have her get her 20-year watch.
all right, thank you.
Thank you.
Thank y'all. 40 years of experience sitting right there. So, our other award winners, our 5-year award winners are Tawana Daniel, Alicia Gregory, Kevin Kreischer, and Latricia Lyons. We had one 15-year award winner, which was Harvey White. So those were our folks with the last quarter. So we are very thankful to have these folks and have this good work coming from them and them being with us for this length of time.
Very nice. Okay, so moving on our agenda, we have one item for consent. It's on your agenda. And if I could have a motion to approve, please.
I see Dwayne.
I think Daron, okay. And a second, please. Catherine is raising her hand. So Susan, we're going to have to take the roll again.
Okay, Chair Cox,
Approve?
Vice Chair Bunch. Mr. Dancy,
Approved.
Ms. Nelson,
Approved.
Ms. Parkins Williams.
Thank you. Okay. Moving on into items for report. The first topic on our agenda today is the adult holiday cheer. And I'm going to turn it over to Jan again.
So I'm Lisa Park, and I'm not sure if Cynthia Ross is going to help or not, but we have Lisa Park, who is one of our supervisors here to talk about what's going on with the adult services and holiday cheer.
Yes. Good afternoon. Is it okay if I
Yes.
remove this while talking? Thank you for having us. I just wanted to go over a little bit of kind of what it is that our project entails. I know it's only October. We haven't even hit Halloween yet, but it's time to start thinking about the residents that we serve who live in adult care homes, family care homes, AFLs, and or individuals who live out in the community who may not have all of the things that they need for the upcoming holiday season. So here at Pitt County DSS, we have many elderly and disabled individuals. Let's see if I can kind of cover that.
There you go.
There we go. It's like a lag between it. We have a lot of folks that we are responsible for who live in a residential care facility. When you live in one of those facilities, you only get as little as $66 per month. And with that money, there are things, necessities that they have to continue to purchase with that money. So you hear $66, but the reality of it is that they may only get $25 to $30 after their medications or their co-pays, things that they have to do each month are paid. So with this project, we hope to collect funds and or have people sponsored so that way we can make them feel a little better about the money that they get every month. We know that it can't last them. And then to make them feel like, you know, they're a normal person just like anybody at Christmas, and they can get the things that they want, not necessarily what they need. With this, we have, we're responsible for numerous individuals, and they can be from anywhere from age 18 all the way to, 100. They can live in the community or they can live in a residential care facility. A lot of the individuals that we serve under guardianship are without supportive family or have limited income to support their basic needs. So our agency relies greatly on the community for support in assisting us with this project. After the holiday season has passed, any items or monetary donations that we have left over, we typically use those funds to replenish and or supply hygiene. We have a hygiene supply closet that we can use throughout the year to help support those individuals on a monthly basis. Because we know that, when it comes to the necessities of things that you need, like soap and toothpaste and Polydent and things that our elderly individuals need, the cost can add up. We'll also use it to purchase any clothing and or medical supplies or any other unmet needs that may arise throughout the year. So what can you do to help? There are a couple of things. One of the things that you can do would be to purchase some general items such as toiletries, socks, lotions, or undergarments. We can coordinate a hygiene drive with family, friends, coworkers, or a civic group to collect as much personal care items that we can. Like I said, we use those to supply to people throughout the entire year, not just at the holiday season. And you can sponsor an individual or purchase items that are on their needs list. So every year we ask the individuals that we serve either in guardianship or who reside in our adult care homes or our family care homes to supply us with a list of things that there's some wants and some needs up there. And so you have the opportunity to sponsor one of those persons individually, or you could just make a donation and we will go out and do the shopping and check the items off the list. And that money will help fill the gaps for the ones maybe who didn't get the sponsorship that year. And monetary donations for this project can be mailed to Pitt County Department of Social Services, 1717 West 5th Street. And please make sure that you put attention adult foster, so then that way they know where the funds should be allocated. And if you're interested in sponsoring an adult or have more questions about our program, there are multiple people in adult services that you can reach out to. But the three of us that kind of head it up and will probably have the most information are Tammy Corbett and Jennifer Stroud, who serve as our adult home specialist, and then myself, who supervises the adult home specialist. And we just wanted to say thank you for your continued support. And we look forward to getting as many individuals sponsored as we can. And if not, the monetary donations to help, go out and do the shopping to make their Christmas just as great as ours.
Mhm.
Any questions?
Thank you very much, Lisa. So does anybody have any questions for Lisa?
I see heads shaking yes.
Teron's got his hand up.
Yeah, Mr. Dancy, you have a question for Lisa?
Actually, I was going to ask Jan or Susan to share this with me, and we can. There's a couple of community groups that I would like to share this information with.
Sure, we could send the slideshow to you and you could pick out whatever you want to share.
Yeah, we have an additional community flyer too that we'll send you the PowerPoint. We can make sure Susan has that, and I'll make sure that Susan has the flyer that we also send out.
Yeah, and so maybe next month, Jan, we could get an update in terms of how
Sure.
things are going, and that
Sure,
would be great
definitely.
if we could do that.
Sure.
And
Yes,
keep
sir.
us posted in terms of your gatherings, but I appreciate you coming today.
Thank
you very
guys
much.
thank you for having us.
Okay, next items for report. We actually have two guests today, and looking at your agenda, we've had some discussion in terms of planning our agendas for the next couple months. And I guess we'd kind of frame this as beginning a conversation about the array of housing resources and avoiding eviction, overcoming homelessness. So that's kind of the way that we frame this discussion. We have two guest speakers today. We have Sandy Lee, who is the managing attorney for Legal Aid Office here in Greenville. And we have Ms. Lynn James, who works with Pitt County Planning. And she is actually our coordinated entry lead person for our continuum of care locally. And I think they're both going to share some information with us today. And you'll have the opportunity to ask questions. Sandy's dealing with the eviction crisis that we're dealing with right now, certainly from a legal aid standpoint. And Lynn is dealing on the homeless side of things in terms of resources and coordinating activities around that. So I think I'm going to turn it over to, it looks like Sandy is first on our agenda. So I'm going to turn it over to Sandy and let her go forward with Susan's help here. I think she's going to forward manage the PowerPoint. So Sandy, you with us?
I am.
Okay, thank you. There you go.
Yeah.
Good to see you.
Thank you.
Thanks for coming today.
Absolutely. Thank you, Jim. Thank you for having me today.
Yes.
So while they're loading the PowerPoint, I'll tell you guys again, my name is Sandy Lee. I am the managing attorney of the Legal Aid Office here in Greenville. Our office serves 11 counties in Eastern North Carolina. We are seated here in Greenville, which is our busiest and most populated county for the most part. And specifically what I wanted to talk to you guys about today is the housing crisis, which we have coined the housing tsunami at Legal Aid of North Carolina. So if you could go to the next slide. Just a little bit about Legal Aid. I hope that most people are somewhat familiar with who we are, but we are a statewide nonprofit. We're a public interest law firm. We have offices across the state of North Carolina. There are 20 offices. We serve all 100 counties, but the information that I'm going to give you just a little bit later is primarily about Pitt County or our service area here in the Greenville office. So this slide is actually, if you go to our webpage or our site, excuse me, and that is at www.legalaidnc.org. That's up at the top. This is part of what you're going to see. And the reason I wanted to show you this is because we have lots of information on our website. So anyone that goes to our website is going to see this across the top where we have the red alert box. There are different things that scroll. So there are things that are going to lead you to information about stimulus payments. There's another one that will lead you to information about evictions. They'll just continue to scroll so that folks can just click on something if they see of something of interest. Obviously, there's information about how to seek our services. But more importantly, what I wanted to show you is about at the bottom of this page, and it's about midway. This is actually you scroll down, there's a lot of information. But there are lots of self-help clinics and there's a self-help library. So at Legal Aid of North Carolina, we do help low-income individuals, but there are approximately 220 people, attorneys, and we serve the entire state. So unfortunately, we can't always represent everyone. And one of the ways that we try really hard to address that is by providing information. So a lot of that information is available on our website. and you can click on any of the links and it will provide you information about the different subjects. We hold clinics that are done via Zoom, and then there are some that are just videos. So all of this information is available on our website, and I just wanted to point that out to you because a lot of what you may have questions about, whether it's housing or there's been a lot of questions about unemployment benefits during this pandemic. A lot of that information is available on our website. So I did want to just point that out to you guys. So today we're going to talk a little bit about housing, the housing crisis. If we could go to the next slide. So I think the first question is obviously, how did we get here to where we are today? And when I talk about where we are today, I think that a fair term is confused because there have just been so many orders and moratoriums. And I think it's a little confusing, as to where we are or what's in place or what can happen at this point in time. So there have been a lot of orders, but basically what I wanted to do was just pick out a couple of, I think, what are the most important orders that kind of get us to where we are now. So the first big moratorium, for lack of a better word, was the CARES Act. And that was effective on March 27th. And basically what that did was prohibited landlords from initiating evictions against protected tenants from March 27th through July 25th. And that was for non-payment of rent, for fees, late fees. Now, notice I said for protected tenants. So obviously the question is, well, who does it protect? So it protected tenants who were in properties that had some kind of, were part of a federal program, or if their landlord had a federally backed mortgage. Those were the tenants that were protected. So we usually think about the tenants who had some kind of voucher or some kind of rent assistance. Those were protected tenants. So then the obvious question was, well, what about the tenants who weren't protected tenants? And so then that led us to, on April 2nd, there was a protection a way that those tenants became protected as well, because the Chief Justice Sherry Beasley, North Carolina Supreme Court, stopped most court proceedings, including evictions, until June 1. So while she didn't specifically say no evictions by stopping court until June 1 of most kinds of cases, then there weren't any evictions. So we had the CARES Act on top, and that was in place from March 27th and through July 25th. And then and that protected certain tenants. And then we had Chief Justice Beasley's order that went into effect on April 2nd, and that got us to June 1. So we had some battling dates. So for certain tenants, nothing was going to happen until June 1. And then for the protected tenants who had some kind of, who were part of one of the federal programs that were protected, they had protections until July 25th. Now, let me also add that at the end of that moratorium on July 25th, before a landlord could evict a tenant who was in a protected property, they had to give a 30-day notice. So for the protected tenants, we had from March 27th to July 25th, they couldn't be evicted, and this is for non-payment of rent. And then at the end of the July 25th, they had a 30-day notice provision. So most of the protected tenants were not going to be able to be evicted until August 25th. So we have that floating out here. But notice I did say for non-payment of rent. So in theory, under the CARES Act, folks could be evicted for other reasons. So if there was a breach of the lease or something like that, they could still be evicted until April 2nd, when Chief Justice Beasley put her order in place that stopped most courts, not emergency courts, but evictions. So that gets us to June 1, everybody's protected. So then we're coming up on June 1 and we're thinking, okay, evictions are getting ready to start up. There are going to be tons of evictions. Well, then Governor Cooper he put an order into place that was effective May 30th, and that stayed evictions again for non-payment of rent until June 20th. So that kicked us out a little bit farther, and we were like, okay, so we're good until June 20th. Folks won't be evicted for non-payment. We have a little bit more time. So then at the end of that time period, the evictions started. And there were a lot. Most weeks there were, and this is the numbers I'm talking about, are Pitt County. Most weeks there were close to 100 a week for a while. There were a lot of evictions. And there was a lot of confusion still about what could happen. There were affidavits that landlords had to fill out so that they could prove they didn't have a tenant who was protected. There was just a lot of confusion. So we have been having evictions until just recently, when the CDC also entered or gave their order. And that was effective on September 4th, 2020. And that halts residential evictions of covered persons through December 31st of 2020. So again, we're back to, and that's really what's the only thing that's in place at this point in time, but we're back to, well, what's a covered person? So basically a covered person, there are certain things that they have to do, but they have to provide their landlord an affidavit that says that they have been affected by COVID, that they have used or taken advantage of all programs, governmental programs, assistance programs, to try to pay their rent, that they're not going to be able to pay it, that their rent or that their income is below a certain amount, and that without the protection of the moratorium, that they're likely to be homeless. That's really where we are right now. That's what we have in place now is the CDC order. That is relatively new. As you can see, it went into effect on September 4th of this year. There have been some federal challenges to the CDC order. A couple have settled. There's one that's still pending that I'm aware of. But basically, folks are challenging the constitutionality of this order in federal court. The CDC has since come out and said that this order does not in any way stop the actual filing or beginning of a process for eviction. The only thing that not the only thing because it's huge, but what it does is that it stops the actual eviction of a person. So in other words, a landlord can file for an eviction, they can go to court, they can get the order entered, they just can't evict the person from the property at the time until after December 31st of this year. One of the other things that this moratorium does is, again, the tenant has to file an affidavit and provide it to the landlord, but it's done under penalty of perjury. Landlords have been advised that they can challenge these affidavits. And so tenants are actually having to defend in court why or how they've been impacted by COVID and how that has made them unable to pay their rent. And it's caused a lot of confusion. The CDC order, it definitely offers some great protections, but there is still a lot of confusion about these orders. So that is where we are at this point in time. We have evictions that can't go forward for non-payment of rent for covered persons. And those are the people who do certain steps, the affidavit basically. That affidavit is available online on the CDC website. And then also Legal Aid of North Carolina is providing affidavits and assisting folks with these cases. Next slide, please. So all of that was background to where we are. And what I did find interesting is that I pulled numbers and I did a comparison of our housing cases that were handled by this office last year and this year. And the percentage is about the same. And I find that interesting because keep in mind that for 2020, there have been, since the end of March and through now, there's just been a little bit of time where evictions were actually going forward, but we've handled the same amount or the same percentage of cases. I think that's important because while I said earlier that most courts were suspended, domestic violence cases were not because they're considered to be emergency cases, and that's the green part of the pie. But those are the cases that we always have the largest number of cases. Housing is always our second largest. But the percentages are very close to the same. And again, I think that's interesting just in light of the fact that there were so many months where evictions weren't happening or weren't taking place. I will tell you that we have seen an incredible uptick in the number of housing cases that we've received over the last few weeks. We are filing a lot of temporary restraining orders. And helping folks file the affidavits to provide or prepare the affidavits to provide their landlords. Landlords who maybe aren't accepting the affidavits are going forward because there was some confusion initially about what the affidavit or what the CDC moratorium did. We were filing the temporary restraining orders and stopping the evictions. At this point, we've still had to file a couple of temporary restraining orders because landlords have sought to get a writ. So that is something that we're working on. Again, our numbers are still continuing to grow, and I anticipate that they will continue to grow throughout the rest of this year. And at the end of the year, when the CDC moratorium expires, absent something else being put into place, I anticipate that we will see huge numbers of evictions, folks who are facing writs and who are going to be locked out of their homes. And I did want to share with you, if you are aware of folks who have questions or need our assistance, if we could go to the next slide. This is how folks can get assistance from Legal Aid of North Carolina. Obviously, on the first slide, our phone number, there's a way to apply online, and you can apply online and by phone, excuse me. And our address is www.legalaidnc.org, or you can call our Legal Aid helpline, which is listed there, our senior legal helpline, and our fair housing helpline. All of those are ways to seek assistance from Legal Aid of North Carolina. I'll tell you that in the last few weeks, we have our helpline, and that is it's located in Raleigh. Folks can just call into that number and they speak to an attorney or a paralegal or intake specialist. They provide information to have a file opened, and then their file is transferred to a local office. In the last few weeks, the call volume has reached anywhere from 900 to over 1,000 calls a day. That has led to some very long wait times. Unfortunately, some of the calls don't get through, but the majority of those calls are folks seeking assistance with housing issues. So again, I think that we have only just touched what's coming as far as the housing crisis, unfortunately. And I think that there will continue to be confusion throughout the year. Depending on if something else is issued or what happens with the moratorium, or if something's issued at the end of the moratorium, I don't know what it looks like, but I anticipate that there are going to be a lot of folks who are facing eviction. I think one of the bigger problems that we've seen is that there also seems to be some confusion on the part of the tenants. And while they are protected from eviction, their rent is still due. It's a horrible situation. A lot of folks aren't able to pay the rent right now. They've had decreased hours at work, or had to take time to take care of kids who aren't in school, but the rent is still due. The amount of money owed is still due. Minus or short of a way to help these tenants or find the money to help negotiate something, I think that we will be seeing a lot of evictions at the end of the year and early in 2021. And next slide. And my contact information is here. If anybody has any questions for me at any point in time outside of today, you're more than welcome to email me or give me a call. I'm happy to talk to you about any questions you may have about Legal Aid of North Carolina, how to seek our services, what services we offer, or just provide any information that I can. Thank you.
To our board, does anybody have any questions they'd like to ask Sandy, please?
I see none.
Okay, again, Sandy, thank you very much, and appreciate your work on this. And we're gonna. If anybody has any questions, we have your contact information, and certainly they can follow up with you. So thank you very much, Sandy.
Thank you.
So next on our agenda, we have Lynn James, and Lynn works with our planning department here for Pitt County, and she is our coordinated entry lead person for our continuum of care, and she works a lot with our homeless population. And so when we talk about a continuum of care with housing, we're talking everything from preventative services to services for the homeless, and then moving right into preventative services. So I'm going to turn it over to Lynn and have her talk a little bit about coordinated entry and things that she does. Hey, Lynn.
Good afternoon, everyone. Can you hear me okay?
We can, thank you.
Great. So thank you for having me this afternoon. As Jim mentioned, I work a lot in the area of housing programs, particularly with people who are homeless in our community. And one of the ways that we get the work done that we are able to accomplish is by coordinating services with other agencies, one of those being legal aid. So I'm glad to see Sandy part of the meeting today, because there are certainly things that we're not able to do that are outside the scope of the services we can offer. But in terms of what the county is able to do is we coordinate services to house homeless people in our community. And when I say homeless people, we are following a definition that is given to us by the Department of Housing and Urban Development that includes people who are living in places not meant for human habitation, people who are living in shelters, which could be emergency shelters or domestic violence shelters, and people who are living unsheltered. So it includes both of those groups of individuals. And it does not include people who are doubled up. That means living in someone else's home, who are living somewhere temporarily called, sometimes you hear it referred to as couch surfing. That does not actually qualify as being homeless under the programs that we are funded to provide. So we many times will get calls from people who are saying that they don't have a home. They consider themselves homeless because they don't have a permanent place to live. But we do have very much have to be very careful about following that definition in terms of how we're spending the money that we have available. So what we do in a nutshell is that we start with an assessment of people who are in a homeless situation, and we confirm, number one, that they are homeless, and that can be done by receiving documentation from an area shelter or by having an outreach worker go out and meet with the individual and determine, or family, and determine that they are in fact literally homeless. Once that has been determined, then we complete some additional assessments that involve looking at what their barriers are to housing, what are the types of support services they would need in order to be successful in maintaining housing. And that information is then put into a rubric, so to speak, that gives them a score that determines whether or not they would qualify for our programs. The higher the score means the more barriers there are to living successfully on their own, and the more support services that they will need to have connected to their household in order for them to be successful. The county itself offers two programs that are called rapid rehousing programs. The rapid rehousing programs are short-term housing assistance that is made available to qualifying families and individuals. And the rapid rehousing can last from anywhere from 3 months to 24 months. Unfortunately, Pitt County's funding streams do not typically allow us to support a family for nearly that length of time. The law will allow up to 24 months. More times than not, we are serving in the 3 to 6 month time frame. This current year with the COVID pandemic, we have seen ourselves carrying families for longer periods of time because of the challenges in the market in terms of employment, being behind on rent and utilities and those sorts of things. So we may be carrying people longer than we typically would, but normally we're looking at more in the range of 3 to 6 months assistance that we would be providing to the homeless families with whom we're working. When I say rental assistance, this means we can help pay with our programs deposits that are required in order to move into housing, whether that's security deposits or utility deposits. We can help with first month's rent. We can sometimes over the course of time pay a portion of rent or a portion of utilities if that's necessary. But what we're going to be doing is trying to work with the household to get them to the point where they're gradually able to assume those responsibilities and make that part of their monthly budget so that they can then, when the rental assistance goes away, sustain that housing. So, and that's why it's called rapid rehousing, because we come in, we assist, but it is short term. It is not meant to imply that we can house you overnight. It's more meant that it's a short term intervention to help a family become housed, and hopefully they can sustain that over time. For those that have higher barriers to housing, there are what are called permanent supportive housing programs that are not administered through the county, but that we can refer to. And those are offered by the Housing Authority of the City of Greenville and Trillium Health Services. And so if a family is assessed and determined that they would be better candidates for permanent supportive housing, then we can make those referrals. One of the things that we're seeing, as Sandy alluded to, is an increase in the demand for housing assistance. And we do receive a lot of calls from families that actually don't qualify for our services. That's why I thought it was very important to make it clear that we are really in the homeless bucket. That's where we fall. And it is, in the whole scheme of things, it's not a large pot, of money, and is not equipped to handle all the housing needs that are out there in the community. So I think it's important when we're making referrals that we recognize that there are people that are not going to qualify for our services. Some even maybe that are homeless for the first time that wouldn't qualify for our services because they assessed too low on our assessment scheme. So we don't want to tell people that we can't assist them, but we also have to look at making sure we're using the resources that we have, which are somewhat limited, to help those families that best qualify and we think could be most successful if we assist them. So that's what our goal is, to make these families successful in moving on and being able to live independently in the housing that they have chosen. So when I mentioned assessment, let me back up for just a minute and say that assessments, we have an outreach worker that's funded through our programs. And this is Margaret Dixon, who many of you may know from her previous employment with Department of Social Services. And she is working with us and can work with those who are unsheltered homeless. She is able to provide that service to Pitt County, and she works in some adjoining counties. We are actually part of a 5-county region that we provide services to. And then if the person is not unsheltered and they're in one of the area homeless shelters, then those assessments can come directly from the homeless shelter. When we're determining who qualifies, we have a weekly housing meeting. It is every Wednesday at 1 o'clock. And our partner agencies, which consist of our referring agencies and those who provide housing resources that we can refer to, meet every Wednesday at 1 o'clock. And we evaluate new referrals and determine whether we can make a referral to a housing program or whether we're going to have to put them on a wait list. like many programs, we do have waiting lists because there are more people in need of service than there are resources to provide the service. So we are critically looking at those to determine who has the greatest need and to determine who we think can be most successful and advancing those as quickly as we can. But like Sandy said, it's a housing crisis, and we know that quickly our resources are going to be exhausted. And we're glad to know that one of our partner agencies, Trillium Health Resources, has applied for and will be receiving money through the CARES Act to also provide rapid rehousing. So this will be additional rapid rehousing that'll be available to Pitt County and surrounding counties, so that if we're not able to serve families, we can make those referrals to what's going to be called the Back at Home program. And through Trillium, we're hopeful that some of those families we can't accommodate will be able to be served. This is funding that will be available for approximately 2 years. And we're glad that it's going to be there because we know the volume, as I said, is going to be higher than normal. We're also looking at what prevention resources are out there. And we're pleased that the Department of Social Services has applied for community development block grant funds, and that can be used for prevention services. We're also coordinating with Green Lamp, which is a community action agency that serves Pitt County. They have some dollars for prevention services, and there will be some dollars available for prevention also through Trillium. So while the planning department in Pitt County through these homeless housing programs don't really have prevention dollars available, we can coordinate with agencies that do have prevention dollars available. So I think that once the issue right now, and I think, again, Sandy alluded to this, is that some of these programs are not online yet. They're coming, but they're not readily available at this time. So we're starting to see that there's some backlog of people needing services that will eventually, over the next weeks or months, possibly be able to access those resources, but they're not available at this particular time. But we continue to operate on a regular schedule, as I mentioned, and we're actively processing referrals and housing people as long as Pitt County's monies are available. And I'd be happy to answer questions if you have any this afternoon.
Thank you, Lynn. And do our members have any questions for Lynn? And that's really a nice segue into our next. Jan's going to kind of give us a little bit of an update, but do we have any questions?
You got Catherine's hand.
Catherine, go ahead. Catherine Nelson.
Hey, Lynn. My question is, how are y'all integrated with NC Care 360 with this population?
We're in the process of starting that. We will be through our coordinated entry program, which is that referral system that I was talking about. We will be coordinating with NC Care 360 to make referrals to Back at Home. So what will happen is when we're not able to accommodate a request, then we'll have a referral process through NC Care 360 that will then process to Back at Home through Trillium. And hopefully that will expand again our capacity to help those in this community.
Okay, thank you.
You're welcome.
So other questions for Lynn? Okay. I don't see any more hands, so I want to thank both Lynn and Sandy. That's great information, and I think next month we're going to kind of continue with having some other guests to kind of continue along this theme of discussion. And it was a nice segue into our next speaker, Miss Elliott here, and she's going to. Lynn mentioned a grant, and she's going to give us an update on the Department of Social Services efforts in that area.
Right. So we have had our first public hearing. We had that on October the 5th. We have a second public hearing that will be scheduled for it's October the 19th, next Monday night. And so hope to get our application in shortly thereafter. We have gotten our participation plan approved. We are working, and I say we, Kevin Kreischer, who is our data grants analyst. I forget exactly what we call him in the office, but he's my go-to guy. And so Kevin is working hard on getting all of this together so that we have a real process. He's been working closely with the folks at Legal Services. He's been working with all the folks on the eviction prevention work group. He's just reached out to the community at large to try and get everybody's input on how to best put this together. We're applying for $900,000 or very close to that. We will use the 10% allowed probably for administration, because we're going to need some staff to help do that. We're going to need to get some things printed, that kind of thing. And so we are hopeful that next month we can come back and say that we have applied and been approved, but we are right now still getting the application together.
Thank you, Jan. So as Jan mentioned and Lynn mentioned too, we have a number of opportunities in the pipeline, and our goal is to keep folks updated. Ms. Elliott mentioned an eviction diversion interest group, and certainly Sandy's on that group, and we meet on a monthly basis, and actually, excuse me, on a weekly basis. And what we do is we talk about these different opportunities and really our need to coordinate and educate each other in terms of what's happening in this area. So we've decided to kind of adopt this as a little bit of a theme for the next month at least, again, to help get the information out and educate our community in terms of opportunities out there. So we look forward to hearing more about, the grant and hopefully have a good outcome to that. So again, I want to thank Sandy and Lynn for their presentations today, and as I say, we're going to continue on this theme for the next month or so in terms of things. So moving on here, we're gonna roll right into Jan's report here, the director's report.
And we'll make this really quick. There, you all have received the timeliness application report, and as you can see, we have bounced back. We did meet our application processing timeliness for MAD at 91% and for other Medicaid at 93%. Our processing times are below what the max is, so we're doing well there. So we are pleased to see that we're back on track. Our vacancy report, we have 6 vacancies that have been filled since the last meeting. We have 4 vacancies that will be posted this week. We still have several vacancies. There'll be at least 2 vacancies that will be frozen. So folks are coming in. We're moving very quickly now to get positions filled. And so staff are working hard on that. The MOU is back starting January 1. And so I will be bringing that to you to show you what the new MOU looks like next month and to talk about where we're going from there. Our energy staff are in the process of coming on board in November. We will begin with the senior citizens who get food stamps who received low-income energy assistance last year. They will be a little over 1,000 of those folks will be automatically enrolled in the energy program, and in December we'll begin taking applications for the remaining senior citizen population, and then January through March the normal process. So that is gearing back up. Do want you to know that the Healthy Helping program that we've talked about before, as of this morning, we had 248 households here in Pitt County who have enrolled in that. And I talk to one lady pretty regularly, and she tells me how much she's gotten back into eating fruits and vegetables because this has been available to her. So she's very appreciative. And the budget season has begun. So we will begin talking about that too very soon. So that's my quick report to y'all, and I will stop there and see if everybody's got questions.
Any questions for Ms. Elliott? Okay, we're coming to the, let me see here. No.
Oh, got a hand up.
You've got a hand. Ms. Perkins-Williams.
Yes, thank you, Ms. Elliott, for sending your reports. I really appreciate them. I know you've been busy, but I've been reading and this, I don't think would, a personal notice. I've been reading the newspaper and I'm looking at all of the violence and social issues in the newspaper. I know you can't do anything about that, but I'm wondering about, have you and Trillion discussed, or what can be done? How can we help the community? Is there anything on the website that may help the community be a part of a solution of a mental state? Because the family issues can be addressed through therapy or something, or counseling or something. You know what I'm trying to say?
I sure do. And Trillium has been out. We have in our office a lot of flyers about the resources that they have available for families. You can go on their website and see the different resources and how to access them. You can certainly call their 1-800 number and get connected with somebody. So there are many ways to connect with Trillium. Our community child protection team will be meeting on Tuesday, and we will be having some conversations about some of these exact same issues that you're talking about, particularly the ones that relate to children and families. So I agree. It's been very scary, very concerning, and as a community, we've got to come up with some ways to address that.
Well, you know, as a native of this county, there was a time when we had counseling session, a building. It was over near the hospital. And if someone was really depressed, disturbed, or all of those mental states that make you want to just walk into somebody's office and help you sort through, it was there. And I know that when I went, you just can't walk into Trillion. I know that because I went to just get information to hand out to people. But I want to know, where is there a place, I'm sorry, is there a place where someone can get that kind of immediate emergency stress relief? I guess.
Yes, ma'am. And right now, a lot of folks are doing things remotely, even the therapist. So the best way is to call the Trillium helpline, and they can connect folks with immediate resources. If they're in serious crisis, they have a mobile crisis team that might be able to come out. They can connect you with various therapists, other kinds of groups that you might can work with. I mean, there are a variety of resources out there. We can certainly ask Trillium to come and have some of that conversation with us again, because it's been a while since they've been here, and can make sure that the community knows how to access those services.
I'm very much for that, because I'm real concerned that it's needed. And if we can do that, do we have anything on the website for social services that's easy to get at?
I don't, but we certainly can get something put on the county website. I'm sure that we can work with them around resources for folks, and I can get those from Trillium, so we make sure we're giving the accurate information.
And I just so you know, I do plan to call or speak with the sheriff and see if there is anything on her website as relate to that, because that's preventive as well as preventative of a crime, as well as maybe a relief of the mind. Thank you very much.
No, thank you for those questions, Mary. And those are, very good points. And those are something certainly we can work on in terms of getting that information out, and maybe getting some speakers here also. So I appreciate those comments. So coming to a close today, we're moving on to board member comments. So anybody have any comments today? We've had a good meeting today, lots of information. Catherine?
Jim, I just want to thank Sandy and Lynn for coming today and enlightening all of us about what they are providing to our community. I know that COVID and this pandemic has just exacerbated things for the homeless and made things so very challenging. And so I'm real grateful for the work they do. My team at the hospital has worked with Sandy in the asthma program there, and we know that she's a gem. So we're just so thankful that they can work together and help bring some relief to this population. Thank you so much.
Thank you, Catherine.
Sheila was next.
Sheila? Dr. Bunch? Dr. Bunch?
Yes, I'm here. I'd just like to congratulate the newest employee of Pitt County DSS and to congratulate those who received longevity awards. And then I would like to thank our guest speakers for coming and providing that information. I like to see coordination of services, and it looks like that the Pitt County, Eastern North Carolina community is coming together to look at this whole idea of different levels of homelessness. And lastly, I would like to thank Jan Elliott for her continued leadership in moving the agency forward, and especially during these unprecedented times. Thank you.
Thank you, Dr. Bunch.
And you've got Mary.
And Mary? Commissioner Perkins Williams?
I forget to unmute myself. I'd like to say thank you to all of you. These are perilous times, and I like to say I like the new addition to the board, and I like the fact that the manager and the personnel director as well as Dan found a way to recognize the longevity people, because I think that's a new slot for our agenda. Is that right?
Mm-hmm.
That's
right.
I think it is. And I think it's a good addition to the board director and the chair of the board. You know, sometimes it just need to see the positive things because there are so many other things that's going on. And I like to say to Catherine, I know you helped with testing. I was delighted to see in the newspaper today the testing of the COVID virus that Biden has taken on again, because there needs to be, the only thing I didn't know was exactly where it was located, that it did not give the address. But you need to have something to refer people to, because it can come, it can go, and people are still concerned about it. So I'd like to say thank you to you and your colleagues, Catherine, for that ongoing effort indefinitely. And thank you to our guests. And Sheila said it best, and I appreciate it, the way she said it. Thank you all. And if it's appropriate, I like to make the motion that, am I the last one? I like to make the motion that we adjourn.
Okay. And if there's no more comment, if we could have a second to that. And I see Mr. Dancy raise his hand. And I guess we need to go through our process in terms of taking a vote to that.
Chair Cox?
Move to adjourn.
Vice Chair Bunch?
Move to adjourn.
Mr. Dancy?
Move to adjourn.
Ms. Nelson?
Turn.
Ms. Perkins Williams?
I approve.
Meeting's adjourned. We'll see you next month. Thank you.
Bye-bye.
Bye.